Hey guys, my name is Ben Aniati and I am a physical therapist and an occupational therapist. And today I'm going to be talking about back pain. Yes, back pain. A lot of people have back pain. I've been working throughout the years in outpatient and doing house calls, and a lot of people have back pain. People have back pain that don't go to physical therapy. So I'm giving you some exercises to help with back pain. More specifically, this is for people, they may be a little bit older population, so maybe at least 50 years old, but it could be anyone at any age really. But the diagnoses of a back disorder is going to be for it's called spondylolisthesis. And so what that, I know it's a long scary word, but basically what it means is a forward slippage of the lower spine, of the lumbar spine. That one vertebra is slipping forward. So again, it's called spondylolisthesis, and it's more common as we age. And so I'm going to be showing exercises that are more flexion-based. So flexion meaning forward. So any exercise that we're going to be doing is either we're flexing our hip or bending our hip and our knee up, or bringing our back forward. And by doing those two different movements, that's going to be strengthening your core, taking pressure off the lumbar spine. And again, as we age, a lot of people, we get stenosis. So stenosis, that means narrowing of the spine. So yes, it is very normal for our spines to narrow, especially as we age. So a lot of people I know, when they go for an MRI, because if they have a lot of back pain, they show whether you have spinal stenosis, degenerative joint disease of the spine, degenerative disc disease of the spine, and everyone gets freaked out and they get scared, like, oh my God, I have all this stuff. And unfortunately, a lot of people opt for surgery without trying physical therapy first. And physical therapy, maybe it doesn't work for everyone. It works for most people, especially if you, again, do your exercises and are patient, because you can't just do like 1 week of exercises and all your symptoms disappear and you're going to get fully better. It's really going to take at least a couple of weeks to fully get better. But I know I'm talking too much, so let's get into the exercises. So again, just one more quick thing. Because our target is going to be for people that have stenosis and or spondylolisthesis, we're going to be doing flexion exercises. So again, bending forward or bending the knee, and we're going to avoid extension exercises. So all these exercises, we're going to avoid the extension. So these are safe for people with those diagnoses or for back pain. And these exercises you could pretty much do even if you have certain discomforts or not this specific diagnoses, but please reach out to your doctor or your local physical therapist before you try these. All right, so let's get into it. So the first one is just we're gonna warm up the spine. So I'm gonna get on my hands on knees, and I want you guys to do this with me. So I'll do this slowly. I'll give you a chance to get into the exercises, and by no means, I'm not like a gym instructor. I'm a physical therapist and an occupational therapist. So please, reach out to your doctor or your local physical therapist or occupational therapist first before you start these exercises. So first, it's just called a cat-cow, just to warm up the spine. So what we're gonna do is we're actually going to just do one form. So we're not going to do the extension part, we're just going to do the flexion. So you're just going to round your back like this. So you bring the top of your back towards the ceiling for a couple seconds, and then you relax. So I know it looks like I'm not really doing much, but you kind of want to bring your back up, hold that for about 5 seconds, and then you come back to midline, so in the middle. So I don't want you to extend like this. I don't want you to extend like that. So again, you just start in neutral, and then you bring the top of your spine towards the ceiling. And I know it may be a little hard to see, so I'll just take this off. Alright, so maybe now you can see a little bit better. So just like that. So remember, don't hold your breath and hold it for about 5 seconds when you come on top. And then you relax. So you see how my hips are coming forward a little bit? Good. So that was, let's do a couple more. We're gonna do this 10 times just to warm up. Good. So just think about you're squeezing your glutes, bringing your hips forward, top of your spine towards the ceiling, and then relax. Good. That was 8. Let's do 2 more. Good. 9. 1 more. Hold for 5 seconds. Don't forget to breathe. Good. All right, so that's just a little warm up. Next exercise, we're going to be doing some pelvic tilts. So go ahead, I'll have you lie on your back whenever you're ready. You're going to bend both of your knees. And this one is also just a warm up for the core. So pelvic tilts. So all you're going to do is with your belly button, you want your belly button to go down towards the mat or towards the floor. And you want your low back to be flat. So you hold that for a couple seconds and then you relax. We're going to do that 10 times. So right now, maybe I have an arch in my back. So I want to push down into my hands. So you want to make sure the lower back is flat against the mat. And then relax. Good, so we're going to hold this for 5 seconds. Remember, don't hold your breath, and we'll do it 10 times. Good, that's 3. Good, 4. So just remember, when we're doing this, we're engaging our core. You want your low back to be flat in the mat while you're breathing. Good, so it's just a very tiny movement. So pretend like there is a bowling ball dropping from the ceiling and it's gonna go onto your stomach. So you're bracing your core, but again, you're not sucking in your core, you're breathing. So keep on breathing. Good. That's 6. I'm gonna do 4 more. Hold for 5 seconds. Good. 7. 8. Good. 2 more. 9. Good. 1 more time. And 10. Good. All right, so next we're going to be doing some more flexion-based exercises. For the next exercise, we're going to do a double knee to chest. So by flexion, again, either bending the knee or bending your back forward to engage your core. So going to lie on your back, and if you're able to, hold both of your knees, and you want to pull your knees into your chest. And I want you to hold that for about 10 seconds. Remember, don't hold your breath. And then relax, good. And then back again. So these should feel good, especially for people that have back pain, or people that have stenosis or spondylolisthesis. This should help with your symptoms. If at any time this is causing your symptoms to be worse for whatever the reason is, please stop exercising. Good, that's 3. So we're gonna hold for 10 seconds. We're gonna do it 10 times. Remember, don't hold your breath. You wanna take some deep breaths, especially when you stretch. That's gonna help stretch out your muscles to take pressure off the spine. Especially if you're having any pain down your leg. If it's a burning pain, usually that means it's coming from a nerve. and I'll show you a good exercise for the sciatic nerve soon. So a lot of the time when people have stenosis or spondylolisthesis, they may have that pain down the leg or burning pain down the leg. So right now we're opening up your spine to take pressure off that nerve, so you may have less symptoms. Good. All right, we got a couple more. Remember, hold for 10 seconds. We're going to do it 10 times. Good. I believe that's number 7. Let's do 3 more. Good. 8. Good. 9. One more. Remember, you want to pull your knees up to your chest as much as you can while keeping your low back flat on the mat. And 10. Good. Very good. All right. Next exercise. Similar to what we just did, the double kneaded chest. So you did a passive stretch just then, and then now we're going to do some marching. So same movement, but we're going to actively engage our hip flexors and march. So just make sure when you march, your low back, there's no arch in your back. So you do that pelvic tilt again. So squeeze the core, low back flat, hands relaxed, and then you just bring your knee up and then alternate to the other knee. Good. We're going to do 3 sets of 10, and it's going to be on each side. So we're going to alternate. Good. So 3, 4. Good. Just remember, you want your core engaged this whole time, but don't hold your breath. Keep breathing. Keep your low back flat on the mat. Good. And you want to really control your hips. So at the side of your hips, you don't want it to move side to side when you do this. So really brace that core so your hips are even to this facing forward towards the ceiling. Good. I believe that's 8. 9. And 10. Good. All right, take a quick break. And remember, you want your knees bent this whole time, so your feet are on the floor, so your low back is stable. All right, let's go for the second set. 11. 12. Good. 13. And sometimes your knees, they may want to go out to the side more, or they go inwards more. Try to get them straight with the level of your hip bones. So just in a straight alignment. So not out to the side either way. You want to just bring it towards your chest. Good. I think this is number 17. 18. 19. And this is number 20. Good. Take a quick break. Good. All right, let's do one more set. And 21. 22. Just make sure your low back is flat on the mat. If for some reason it arches, that means your lower back muscles are getting tired. So if you feel like that's happening, you could take a break, or you could put your hands under your low back to give it some more support. So you have that tactile support, that feeling from your hands for your low back to touch towards the mat. Good, 2 more. 29, and 30. Good. All right, take a quick break. All right, so next exercise we're going to be doing that's also good for a sciatica. So that's when the sciatic nerve is compressed in the lower back and you have that pain down the back of your leg. You can still do this exercise even if you don't have that. It's also good to stretch your hamstrings. So it's called sciatic nerve glides or an active hamstring stretch. So again, line your back. You can start with both feet on the mat. Hold one leg in the back of the thigh here, and then you just bring your leg up, point your toes towards your nose for a second, and then come back down. 2. And so you may feel a stretch in your calf and or the back of your leg. So we're going to do this 30 times on each side. So we'll do 2 sets of 15 on each side. Good. That's number 8. 9 up, you hear that crack. Good. 11. And if you have a crack, don't freak out. It's just tightness of your joints. All right, switch sides. If you have any pain after the crack, then you want to sit back, relax, but most of the time it's just tightness of the joint that's released. So what a crack is, it's really just in any joint. So let's say my knee, of what just happened where my knee cracked. It's just a release of pressure from the liquid in my knee. You hear it there too. And then when it cracks, it turns into a gas and it releases the pressure off that joint. Good, 3 more. 13, 14, 15. Good. Switch sides. So 1 more set of 15 on each side. Good. So just remember, hold the leg, point your toes towards your nose just for a second. And you don't want to really hold it for too long because it's going to put a lot of pressure on the nerve. So just like about a second, you point your toes towards your nose to get that more of a stretch in the back of your leg. Good. 2 more. Good. Switch sides. And again, if for anyone that can't reach the back of their leg, you could use a towel and wrap it around your leg. So you could hold it like this, for instance, if I had a towel in my hand, and I'd put it around the back of my leg, and I would do the same thing like this. If anyone has limited mobility, then that's definitely a good option. So you could use a towel. I like a Long Beach towel. Some people like to use a belt. So kind of whatever you have around the house. Good. All right, we're winding down. So a lot of people that have back pain from the lower back, we want it to improve your stability, which some of these exercises may help with that, but also the thoracic spine, so the mid back and the upper back, you want to stretch also. So the next exercise we're going to be doing is called open books. So all you do is lie on your side. You can put a pillow under you if you like. Bottom leg is straight. Top leg bent at about 90 degrees. Hold that down with one hand, the bottom hand. So right now I'm lying on my left side, left hand on the knee, right hand over, and then I'm going to reach up towards the ceiling and then towards the other side, and I get a nice rotation in my upper back. You may get some pops in your upper back. So for the thoracic spine, we're rotating your spine. So the reason why you put your hand on top of the knee is because it's going to want to come up like that. So you keep that down, you'll get more of a rotation. Okay. So this one, yep, that's number 7. Good. 8. 9, and you want to turn your head also. 10. Let's do 15. 11. 12. 13, 14, 15. Good. Now we're going to go to the other side. And for me, I'll do a little butt spin action so you can see me on this side. All right, so same thing, just on the other side. So now I'm on my right side, hold with my right hand, down on the knee, left hand forward, reach up and back. Good. 2, good. So same thing, we'll do 15 times. And you may feel one side a little bit more stiff than the other. That's completely normal. Good. 4. I think that was 5. Yep, so this is number 6. 7. 8. 9. 10. Good. 5 more. 11. 12. Good. 3 more. 13. 14. 15. Good. So we did 15 times on each side. If you want to do another set of that as well, pause the video, do it 15 more times on each side if you want to get 30 times in. If not, we'll cool down with one last stretch. So we're going to stretch, this is called a gluteus / piriformis stretch. So all you're going to do is lie on your back and you're going to cross one leg. Yep, so you're going to put your ankle on your knee here. Good. And then you're going to lift up and you're going to put your hands in between your legs, your inner thighs, and then the other hand on the outside. Good. And you just hold this. So really you want to hold this for about 30 seconds. And you want to make sure you're not like leaning to the side. You want to make sure you're straight, and you should feel a stretch. So right now I'm feeling the stretch mostly in my right hip and my right buttocks. And it feels like a pretty good stretch. So a lot of the times our hips get tight when we have back pain, especially in the lower back. Good. All right, so that's about 30 seconds. And then we'll switch sides. Good. So same thing. Now my left side, my hand's in between my thighs. My right hand is on the outside. And if you want to get a little bit more advanced, with my hand that's on the inside, my left elbow, it can push down a little bit on that left knee, and I'll feel the stretch a little bit more. So I feel that right over here. And it feels like a pretty good stretch. So we're going to do this for 30 seconds. Make sure you're taking deep breaths. Good. And relax. So that stretch, that's a good stretch. Just based on time, we'll stop right here, but you want to do that last stretch 3 times, 30-second holds 3 times on each side. And then yeah, just to wrap up, so again, this is for exercises that are mostly based for patients that have stenosis and or spondylolisthesis. So these are all flexion-based exercises. And if you have any questions, feel free to reach out to me. Again, my name is Ben Aniati, physical therapist and occupational therapist. And I hope you all have a great day. And keep on exercising, keep on moving. You got this. Take care.